You can
use
state your
Joan?
name for me. Yeah, you can do Joan.
Okay, Joan Tilton.
Right? And what brought you into the office for treatment?
Recovering from surgery to remove a mass on my left side, which had been growing for several years, and it was time for it to come out. But in that 2-year period, my ability to walk without assistance, either a walker or a cane, and it was just hard, and there was constant pain. Constant pain. And I don't like taking the medication. A lot of times I would just take, if ibuprofen, most of the time I was taking Tylenol. And if it took the edge off, I was fine. And I wouldn't go to a narcotic. I don't like them.
Those never
So it was actually my Bible study teacher, who is also a patient here.
Oh, wow.
Diane Thompson. And she had been having difficulty with her knee. And she happened to text me telling me that she had stopped off. And later, I got thinking about what she told me, and I called her, and I said, what's the name of this place? Because she didn't tell me what the name of the place was. And I said, what's the name of that place you're going to? And do you think that they could be helpful to me? And she knew the condition I was in and how difficult it was to walk and all that. She says, well, I don't know. And I said, well, do you think I could just call and set up a consultation and go in? She said, oh yeah. So, okay, fine. So that's how that started.
Awesome. And
so I did. I made the appointment, and I met with Dr. Greg, Dr. Evan, and Jessica. Jessie, yeah. I call her Jessie.
Yeah. So how are you since receiving the treatment?
I feel, if I were to use degrees, I would say I'm just shy of a 380.
Awesome.
Yeah.
That's great.
360.
Yeah, that's some great turnaround.
Yeah, otherwise I'd be way out there.
Yeah.
No, it was, and I say just shy because when I don't have to pick that up at all, I'm going to say I'm 100% better.
Yeah, definitely. That's great, your improvement though.
Oh my gosh.
And then,
and they would say when I would be like on the table with either of the doctors, it didn't really matter. They would say that the adjustments were holding.
Yeah.
And I said, so is that a good thing?
Yeah.
Because I don't know. But I do know, even after the very first week, I thought, this is what I need to be doing. I just knew that because I felt instantly better after the first treatment.
Oh, wow.
When I walked out to my car, my posture had improved.
I was gonna say you walked a little bit faster. You didn't have that much dip in your limp.
Yeah, exactly. So I was really tickled.
Yeah.
And now, because I've done all the treatments, I think Medicare only is going to cover adjustments. I don't think they cover the laser thing.
I would have to check.
Yeah, I'm not real sure on that, but I do want to find out about it.
Yeah.
And I think, I don't know. I can try calling Humana to see if they wouldn't make an exception, because I feel that's also an integral part.
Yeah, the PT and physical therapy really helps a lot too.
Yeah. So.
And then
they're supposed to come up with a plan.
Yeah, but who would you recommend to come in if you had anyone?
The person I would have, actually one of the people that come to my food pantry,
Uh-huh.
and he does happen to be living in a house
Mhm.
now. He's a roommate with some people because he had gotten a job
Yeah.
and was able to not be in the woods. Can you imagine
Oh my
he was in
goodness.
the woods for both of these hurricanes?
Oh my gosh. Yeah, he
But
must have
anyway,
been
the
beat up.
problem was, he Tuesday came and went, and I'm thinking Tim wasn't here,
Mhm.
and I've got his phone number, so I called and I asked him if he was okay,
Mhm.
and I asked him if he was still staying at that house he told me about, and he said yes, but he took a nasty fall because he has no transportation
Oh,
except a
no.
bike,
Oh wow.
and he took a nasty fall, and he's injured his knee, one of his knees. I don't remember which one it is.
Well, we could definitely help him out with
So
that.
I feel
Yeah.
I asked him, he has no insurance,